Good day everyone, I am Cristy and Laure, and for today I am going to report my topic, which is hemophilia. So hemophilia is a condition that significantly impacts the lives of those affected, often requiring careful management and lifestyle adjustments. So individuals with this disease often have to avoid certain activities that pose a risk of injury, so which can limit their social interactions and physical fitness. The chronic nature of the condition can create anxiety and stress for both patients and their families, particularly regarding the risk of bleeding episode. So hemophilia, which means love for philia and blood for hemo, is the most common severe hereditary hemorrhagic disorder. Hemophilia is a rare inherited blood disorder that causes the blood to clot less, which results in an increased risk of bleeding or bruising. It happens because the body does not make enough protein or the clotting factors to help the blood form clots. So, clotting factors are proteins in the blood. They are part of the coagulation cascade, which is a series of reactions that produce a fibrin mesh that stabilizes the clot. They work with the platelets to form blood clots that control bleeding. Clotting factors also regulate how large the clot is by controlling how quickly it dissolves. We have the three types of hemophilia: the type A, type B, and type C. So first, we have the hemophilia A. So it is the most common type of hemophilia. It happens when a person does not have enough clotting factor 8. The CDC estimates about 10 in 100,000 people have hemophilia A. Factor 8 functions as a cofactor in the blood coagulation cascade for the proteolytic activation of factor 10 by factor 9A. Then next, we have the hemophilia B, also called Christmas disease. This happens when a person does not have enough clotting factor 9. The CDC estimates about 3 in 100,000 people have hemophilia B. So factor 9 plays a crucial role in the coagulation cascade by activating factor 10 and the intrinsic pathway of blood clot formation. Then last type is the type C, also known as the factor 11 deficiency. This type is very rare, affecting 1 in 100,000 people. Factor 11 plays a crucial role in the activation of factor 10, leading to the formation of the prothrombinase complex and subsequent conversion of prothrombin into thrombin. Here's the difference between a person without hemophilia and with hemophilia. So without hemophilia, there is a normal clotting ability. Wounds heal promptly. So there is minimal bleeding during injuries. Can stop bleeding quickly since there is enough clotting factor to form clot. Person with hemophilia, there is an impaired clotting ability due to a deficiency in specific clotting factors. Example, factor 8 or factor 9. Prolonged or spontaneous bleeding episodes may occur without any apparent cause. Hemophilia is predominantly common in male due to its X-linked recessive inheritance pattern. Hemophilia are caused by mutations in genes located on the X chromosome. So humans have 23 pairs of chromosomes, with one pair being the sex chromosomes. Males have one X and one Y chromosomes, while females have two X chromosomes. Two X chromosomes. For a male who have one X and one Y, having one mutated gene on his one X chromosome is enough for him to have the disorder, as there is no corresponding gene on the Y chromosome to compensate. While in the case of females who have two X chromosomes, a mutation in both copies of gene needed to express or to have the disorder. If a female has only one mutated gene and thus one normal gene, she becomes a carrier but typically does not show symptoms of hemophilia due to the presence of the normal gene. If a male inherits an X chromosome with the hemophilia mutation from his mother, who may be a carrier, he will have the disorder because he lacks a second X chromosome to provide a normal copy of a gene. But if a female inherits an X chromosome with the mutation, she may have one normal X chromosome that can produce enough clotting factors, preventing the onset of severe symptoms. However, she can pass the mutated gene on to her offspring. That's why mas dako ang chance na namamana sa lalaki sa kanang carrier mother or sa carrier female ini nga sakit and mag-cause to show severe symptoms. Unlike sa female, dakotan chance but carrier only, which may be asymptomatic and lead to normal lives. The current number of males with hemophilia living in the United States is estimated to be between 30,000 and 33,000. The estimated prevalence of hemophilia in the United States is 12 cases per 100,000 US males for hemophilia A and 3.7 cases per 100,000 US males for hemophilia B. Hemophilia prevalence varies widely across the United States and is highest in Midwestern and Northeastern states. The estimated incidence of hemophilia among US births is 1 birth per 5,617 male births for hemophilia A and 1 birth per 19,283 male births for hemophilia B. Among all males with hemophilia, just over 4 in 10 have the severe form of the disorder. The average age of persons with hemophilia in the United States is 23.5 years. For pathophysiology, first we should discuss the non-modifiable factors. First, the genetics. Since hemophilia is primarily caused by mutations in genes responsible for producing clotting factors, these genetics mutations are inherited in an X-linked recessive pattern, meaning they are more commonly expressed in males while females can be carriers. Then sex. Since hemophilia is linked to the X chromosome, it predominantly affects males. Females have two X chromosomes, so even if one carries the mutation, the second X can often compensate, making it less likely for females to express the condition. This results in a higher prevalence of hemophilia in males. Then the modifiable factors, we have exercise and physical activity. While exercise is generally beneficial, Individuals with hemophilia must be cautious. High impact or contact sports can increase the risk of bleeding due to tissue injury. However, low impact activities can help improve muscle strength and joint stability, reducing the risk of spontaneous bleeding. Then medication use. So certain medications such as anticoagulants such as aspirin can exacerbate bleeding in individuals with hemophilia. It's very important for these patients to avoid such medications unless prescribed and monitored by a healthcare professional. Then next, the infection. So infection can complicate hemophilia management. Also, it can lead to inflammation and increased bleeding risk. Genetic defects on the X chromosome affecting the factor 8 or 9 gene leads to deficiency on functional factor 8 or 9 in the blood. So tissue injury. In hemophilia, even minor injuries can lead to significant bleeding due to the inability to form stable clots. Tissue injury triggers the clotting cascade. However, the deficiency in clotting factors impairs this process. This leads to the insufficient clotting action. The lack of sufficient clotting factors results in an impaired coagulation process. This means that the body cannot adequately form fibrin, which is essential for stabilizing the clot. Then formation of temporary platelets, which is less stable. So when bleeding occurs, platelets aggregate at the site of injury to form a temporary plug. However, without the necessary clotting factors, this plug is unstable and cannot effectively stop bleeding. So the clots formed are weak due to the insufficient fibrin formation. This instability can lead to the disintegration of the clot, resulting in continued bleeding. So the combination of inadequate clot formation and weak clots results in uncontrolled bleeding. NSAIDs, especially aspirin, inhibit cyclooxygenase enzymes, which are crucial for the production of thromboxane A2, a substance that promotes platelet aggregation. This can lead to impaired platelet function, increasing the risk of bleeding. By interfering with the platelet aggregation and function, NSAIDs can prolong bleeding time. This effect is especially dangerous for individuals with hemophilia who already have a diminished ability to form clots due to factor deficiencies. NSAIDs can irritate the gastrointestinal lining, leading to ulcers and bleeding, which poses a significant risk for hemophilia patients. While NSAIDs are effective for pain relief and reducing inflammation, their use in hemophilia patients must be carefully considered due to these risks. So, alternative pain management strategies may be required. The level of clotting factors determines the severity of symptoms. So, first we have easy bruising. Individual may notice bruises appearing with little or no apparent cause. Since hemophilia affects the blood's ability to clot due to the deficiencies in clotting factors, this means that even minor trauma or injury can lead to blood leaking from vessels into surrounding tissues, resulting in bruising. Also, deep bruise, nosebleeds, bleeding, so minor cuts or injuries may lead to excessive bleeding that takes longer to stop. This bleeding may lead to joint hemorrhage. So about 75% of all bleeding in patients with this disorder occurs into joints. The most commonly affected joints are the knees, elbows, ankles, shoulders, wrists, and hips. Also, GI bleeding. This can manifest as blood in the stool or vomit. This can arise from weakened blood vessels in the GI tract, which may lead to lack of effective clotting. Then, hematuria. Blood in urine is a possible symptom, indicating bleeding within the urinary tract. The blood vessels in the kidneys and bladder can rupture, leading to hematuria. Then, intracranial bleeding. Severe cases can lead to bleeding in the brain, which may cause headaches, confusion, or seizures. Then, pain or swelling around joints. This is often due to bleeding into the joint spaces, leading to inflammation and discomfort. So for diagnostic examination, we have family history. Since hemophilia is often inherited, a detailed family history is crucial. The clinician will inquire about any family members with bleeding disorders. Then physical examination, so assessment for signs of bleeding such as bruises or joint swelling. Patients will be asked about any previous of excessive bleeding, easy bruising, or joint issues, particularly after injuries or surgeries. Also, blood exams. The test measures various components of the blood, including red blood cells, white blood cells, and platelets. Also, genetic testing. In some cases, especially if there is a family history of hemophilia, genetic testing may be performed to identify the mutations in the genes responsible for clotting factors. So for medical treatment, we have the recombinant factor 8 or 9. So it is a purified blood clotting protein used to treat hemophilia, a hereditary bleeding disorder. So this recombinant form is injected into a vein to replace the missing factor in the blood and prevent or treat bleeding. Then desmopressin, so it is a synthetic vasopressin analog. It works by increasing endogenous factor 8 plasma concentrations. It has utility in the treatment of patients with mild or moderate hemophilia. Instead of using factor concentrate and thereby reducing the expense and decreasing the risk of development of inhibitors. It can be used subcutaneously, which is the most common route of administration, but can also be given intravenously and intranasally. Then we also have the antifibrinolytic agents, a class of medications that prevent the blood clots from breaking down too quickly, which reduces bleeding. They are used to treat or prevent serious bleeding in patients with conditions like hemophilia. They can also be used to control bleeding during or after surgery or a traumatic injury. For nursing management, teach patients about activity restrictions and self-care measures to prevent the chance of hemorrhage and complications of bleeding. Then, instruct patients to avoid any agents that interfere with platelet aggregation, such as aspirin and NSAIDs, since aspirin may induce a functional platelet disorder. Even small amounts of aspirin reduce the normal platelet aggregation, and the prolonged bleeding time lasts for several days after aspirin ingestion. Although bleeding does not cause in most people, patients with hemophilia can have a significant bleeding after taking aspirin, particularly if invasive procedure or trauma has occurred. Also, herbs and nutritional supplements and alcohol are contraindicated. Then, applying pressure to a minor wound may be sufficient to control bleeding if the factor deficiency is not severe. Splints and other orthopedic devices may be useful for patients with joint or muscle hemorrhages. Frequent monitoring of vital signs is needed. If the patient has had a recent surgery, the nurse frequently and carefully assesses the surgical site for bleeding. So, frequent monitoring of vital signs is needed until the nurse is certain that there's no excessive post-operative bleeding.